We'll say, okay, I know already all this. Maybe for some people there are some new things. So we start just from that point on, and hopefully in the future we can work on protocols, and we do get a good organization. I think we have the possibilities here in the room. Okay. Burns. What are burns? Burn it's not only the burning sensation that one feels when there is a heat injury, but burns are characterized by severe skin damage that really causes the skin cells to die. So you get really wounds which are damaged. Okay, most of the household injuries are burns, especially with children playing with fire when they shouldn't. The simple burns heal quickly, and most of the time we don't even notice it in a way. And even the more severe ones, they will heal pretty well without big scars. The serious burns, they require emergency treatment, and most of the time they will get to the emergency. But and if they're not treated well, you will get complications, which can lead even to fatal death. Okay, the burn levels. How do we which type of burn levels we have? We have the first degree. What is a first degree burn level? Well, we know when we just have a small burn, we say we have the first degree. It's superficial. There are deeper ones. Where's the difference? So the simple first degree burns are just the red, non-blistered skin, a sunburn, a lighter which can burn you at that time. The second degree burns are the ones with the blisters, and some with thickening of the skin, or even like open skin, like ulcers. The third degree burns are the real full thickness skin burns, which we see a thick leathered skin, we see lack of circulation, and even lack of sensibility. And then there's a fourth one. Most of the time we don't talk about it, you don't hear about it, but we have a fourth degree burn level, and that's when the burn goes through the skin and affect tendons and bones. Okay? So there are a variety of causes, like we see. It can be hot liquids, it can be chemicals, it can be electric burns, as we said, from flames or from sun damaging. Watch out with the chemical ones and the electrical ones. Sometimes we don't see it, and even with the hot liquid ones, the skin would show normal on the outside, but the liquids penetrate, and they keep on penetrating much longer than we think. The ones with electrical burns can give burns on the inside without even noticing anything on the outside. Type of burn is not based on the cause, like we said. It could be from level 1 to level 4. Doesn't matter what kind of cause it is. First degree burn, like I said, are the minimal damage burns. They are called superficial burns, and they got, in principle, only the outermost layer of the skin. The signs of a first degree burn, like I said, the redness, the minor inflammation and swelling, pain, a burning sensation, and dry peeling skin, of course, as the burn heals. So it starts peeling, just like when we get sunburns. Here are a few examples. As we see, if we take the anatomy of the skin thickness, we see that only the upper part of the skin is injured. And this is the part of the skin which heals very well by itself, and it will disappear slowly. Most of the time, in 7 to 10 days, a first degree burn is healed. Treatments for the first degree burn, like I said, it's simple actually. First thing is always cooling. Everything which help with which you get with burns because of the heat, we want to cool. So cooling, soak it in cold water. Apply, and they say lidocaine in some of the literature we have. The most important thing is that you try to get away a little bit of the pain. Most of the time the cold will get that pain. And apply creamy ointments. Drying like gels, etc. will dry out the skin, and at the end will still give many complaints. And at this moment, the Flemazine is well known. We know the Flemazine as also an antibiotic cream treatment with a level 1 burns. We hardly have to use that. Cocoa butter is very much used. And we have our Aruban Magic Cream Alhidran from the Aruba Alway Company, which is actually worldwide used in burn centers and is doing a really good job on the skin healing. Second degree. Second degree burns, they go through, like we said, through the first layer of the skin, go to the deeper layers, as we see, and especially with the liquid, like I say, hot water or oil, it penetrates longer than we think. So we cool, and then we think it's done, and by the next day we can still see that the effect gets worse. So cooling is really important for at least 15 minutes, they say, but I will say 15 minutes till half an hour. And do always check, do a revision the next day. The first day it could look like a first degree burn, but the day after you can still see more damage. So it's important that you do the revision at least the day after the burn. Don't use any bandages or appliances which can mask this revision. So even with the Flemazine which we use, which has silver in it and can discolor the skin, we advise to the first 24 hours, don't use the Flemazine if you're not sure, so you can do the revision the next day. The second degree burns, they make blisters. The skin, the layer less, the upper superficial layer loosens up, and you get a wet or weeping appearance, thick, soft, scab-like tissue, and that's what they call a fibrinous exudate. It's like a wet, like kind of a wet crust on it. This may develop over the wound. Now there are different ways of thinking about the blisters. They will say that you can leave the blisters until they heal by themselves. Actually, nowadays with the more aggressive treatment of burns, we pop the blisters. So you don't have to cut the skin away, but we pop the blisters, let the liquid come out, and in a way your skin is going to be like a new skin, like a skin graft over the burn. So it helps, and again, we keep the skin moist. We don't want it to dry out. The treatment, like I said, proper cleaning is important. Clean well, we don't want any infections. Just put sodium chloride 0.9, we pop the blisters, and then we put the first 24 hours paraffin or Vaseline gauze over it if we want to do the revision the next day. After that, we can start with the Flemazine. And actually, we can use the Flemazine actually as a sole therapy for almost the full healing of the injuries. It does a good job, works well. For the aftercare, again, we have this more of the scarring that will come later. We can use again any other moist cream or ointment like the cocoa butter, and again I will suggest in this case our Alhidran. Keeping the area round with large burns, it's important that the area around, when you treat the wound, it's clean, it's hygienic, and make sure that you bandage everything well, and be sure that you won't get any infections. Infections is your biggest enemy with burns. The protection of your own skin at this moment is on a low grade. So it is the flamazine. As we know it, we have it, the silver diazine. The Vaseline dressings, like I said, that we put on over the injuries of Nigeria. Okay, some blisters, they pop open, giving the burn a wet weeping appearance, like I say, and most of the time these burns will heal within the 2 to 3 weeks. If they get complicated, sometimes on the position where they are, if it's over articulation or a joint, or if you still get any infections, it might take a little longer. Okay, with the most difficult ones, which won't heal by themselves, we will have to do some skin grafting, where we take skin from another part of the body, like we say, the split skin grafts. So you can cover the skin. So here you can see the skin grafts. So when we take them off, this is a mesh skin graft. Take it off the upper leg. We can take it from the buttocks, but still it can be used. And that's especially in case of the hands where we need the functional parts of the body. We can do some skin grafting to avoid contractures. Treatments in the mild second degree burn generally include like I said, the cooling of the skin, painkillers, the cream, like we said, and when there is in a functional zone, it's important to go to emergency or at least being treated by a professional. Third degree burn are the more advanced burns, like we say, and actually it's the ones with the most damage, not counting the 4th degree burns. They go fully through the skin. You can see here, so it goes through all the way through the subcutis, and that's where it damages the vessels, nerves, and actually this whole part of the skin is that skin. So it's important to recognize that. And this is something, when we talk about the basic wound care, this is the part where you don't do this anymore at home or just at a outpatient doctor's office or a GP office. They need specialized care, so that's when you go to the emergency hospital, even if it's a small spot, and they need really good care because these necrotic lesions can do more damage, they can get infected, and you might lose even parts of the limbs or part of the skin or tissue where it's situated. What we see? So we see a waxy and white color. Now we see a char over it. It's like discolored, the dark brown color. It's thick, tough, leathery texture of the skin, and actually you don't see any blisters anymore. You don't see any blisters anymore over there because it's all gone. There is no reaction. It's dried out. The whole thickness of the skin is gone. Without surgery, at the end, these wounds will give contractures, and it's not only the surgery; it's also the whole guidance during this treatment of the lesions. Here we can see some 3rd degree burns. They're really nasty burns in the hands where you give many problems, and we want to save it. We want to save the function, we want to save the hand, so we got to jump on them and give them the right treatment. They're not operated directly most of the time. It's not something that it's that is something they come in and we can operate it. No, we have to guide it, we have to do the wound revisions, we have to cut the dead tissue away, which we call necrotectomy, which I will show you. And but we have to guide this whole process if we want to get a good result at the end. Okay? The misconception that they will hurt a lot, these, like I already said, everything is gone. So these people actually, where you have the 3rd-degree burns, they don't have any pain. They don't have any pain in the burn. The 4th-degree, to give you an example, this is the 4th-degree burn. So you see it's a 3rd-degree burn going on through all the layers of the skin, affecting the tendons, affecting the bony structures. And these are really extreme burns, and to treat them, it needs extreme approach. So aggressive therapy, make sure that these people are stabilized in the fluids, but also that they don't get any infections, they're well isolated, wound revisions every day, seeing how it's with the skin, take away the necrosis, see where the vital parts are, and keep on stimulating the surrounded tissues, and then at a certain moment decide what to do. And what to do, we're getting at the same points, as I already said. This is something, it's in Dutch, which the Association of Burns in the Netherlands use as what to do at home. So I just put it to see that the cooling, the most important thing with large burns is the cooling, and the rest will come afterwards. Keep everything clean as much as possible. Don't try to give people food. Don't try to pull off all the clothing if you're not sure that nothing is it's stuck on the patient. So only which is loose you can take off, and try to cover the wounds as good as you can. So I try to make kind of a scheme which to give you an idea what to do the best when you have to do with the severe burns. Cooling is important, 10 to 15 minutes to start with, no ice. Why we don't put any ice, direct ice in the skin? One, the ice scratches the skin and can make it worse. The temperature of the ice is really, really, really cold, so it damages the cell as well. So we suggest cold water. You can put some ice in a plastic bag or in a towel and wet the towel and see that you can cool it like that. But preferably just cold water, running water. That's the best thing to do during 10 to 15 minutes straight up. Take off all the clothing which is not stuck on the wounds, like I said, and then you come into the clinic, and then there's the triage. It's something I put it on for you to kind of understand a little bit how it goes, because these are not the things you're doing in your small office. But the burn levels, you got to be sure what's the severity, what's the percentage of burns. I will come up to that. We have the chart of the percentage of burns for children and for grown-ups. The important thing is that you can use your hand in a way as counting the 1% of the surface, and in a way you can calculate what the burn surface is. If you calculate the percentage of the burns, the 1st-degree burns don't count. Okay, so it starts by the 2nd degrees and up. So with grown-ups, it's 10%. If it's over the 10%, then actually you do have to send such a patient to a specialized clinic. There is some space, depends on where it is, how bad the burns are. Sometimes you can treat them in the clinic to a certain point, but it's kind of the rule there is. For children, it's at 5%, more than 5%. And if it's all 3rd-degree burns, also for grown-ups, it's 5%. Okay. So then, we stabilize. Important is then to stabilize the patient and make sure that there is a good infection prevention. Start with antibiotics, start in a clean, isolated surroundings, and then at the end, just getting back to what are the wound treatment to start with. We start with the flamazine dressings and the regular wound inspections, like I said, eliminating the necrotic tissue, and at the end we have to go up to our skin coverage, and that's, I think maybe in the future we can go more into that, because it's not only the skin grafting. I will show some examples. Let's see. Here you can see where you do the necrotectomy. This is the grafting, but there's still some. Let's see. Let me go back over here. With these kind of lesions, with the skin graft you won't get there. You can't put the skin graft over the tendons. You won't get it close. So we have to go to more extreme solutions, which we talk over local flaps of the skin, or maybe even free vascularized. So that will say skin transplants of whole parts of skin and muscle. With microsurgery, connect them on any other vessel in the neighborhood to close these kind of wounds, if there is a possibility. It's not always you can have the 100% chance. If a whole arm is burned, you hardly will get well vascularized or vessels which are well enough to vascularize a new flap, so then you will have to do it less. And that's always a little bit the choice we have to make. Here are some of the examples where everything was grafted, also in the face. The first closure is one. You can say the more aesthetic part can always come later. The most important is that we heal the wounds, and then from that point on, make it as functional as possible. Secret for giving the best treatment and getting the optimal result, like it's already said, is the multidisciplinary approach. And I think with the burns, that's something we'll really work on, because it's I think it's a forgotten baby in our surroundings, and I think there's a lot we can do to make it better. That's it. Thank you.